How to quickly eliminate back pain without being held hostage by a herniated disc. Hi, and welcome everybody. It's Jason Barlow, RMT. I'm here today as your therapist and as your coach to help you transform any stress, any tension and pain into health, happiness, and vitality. Bottom line, back pain sucks. I remember being back in university. I was maybe 20 years of age. We'd gone out for a couple of beers and some curry, came back, had my plate on my lap, finished off my curry, and I just bent forward, put my plate between my feet. I couldn't get back up. Wicked pain, the worst back pain I've ever had. And as a result, I didn't know whether to try and get up or force myself down. I ended up choosing to force myself down and just lay flat. And that was the only position I could get into that helped relieve the pain at that time. It was debilitating. I remember having to lay flat for almost a couple of days. The doctor came to the house. He prescribed some medication. Eventually, it started to release. Long story cut short, I then started to get some physical therapy and some attention on those muscles. Turned out that it was actually more muscular than it was the disc itself, which was kind of one of my concerns at the time. As I was just going through my schooling, learning more about the body, that was definitely something that flagged in my mind of, oh, is this what a herniated disc can feel like? So let's give a little kind of summary as to what a herniated disc is actually referring to. As you may be aware, in between each of the bones in your spine, which start up here in the base of the neck, all the way down to the base of the spine, the bottom of the lumbar spine, most every single one of them has a disc between them, except up here high up between the atlas and axis. But every one after that has a fluid-filled disc that is self-contained and that basically acts as a shock absorber. It actually helps us to be moving around the spine with rotation and flexion and so forth. Now, as I've talked about in the past, and as I talk about in my book, the 15-step playbook for pain relief, is that our body is designed to do a whole sequence of movements, a whole plethora of different things. And so sometimes people say, is this safe to do? Well, if your body can do it, yes, it is, with the caveat that it's the dose that makes the poison. And that's applied to everything in our life, right? Too much sleep, too much water, too much good food. If you overindulge in good food, you know what you feel like. So it's all about finding that middle way. And it's the same when it comes to posture. Now, when it comes to posture, and we're specifically getting into the discs here, is that a lot of people spend so much of their time loaded and compressed. That is either sat at the desk, as I am right now, sat driving their vehicle, flying aircraft. I work with some pilots, or, they are active and on their feet, but they're loading, compressing the lower part of the spine, especially. Now, more often than not, when it comes to disc herniations, I've seen them up here in the cervical region of the neck, but very, very small percentage of patients that I've seen have any kind of corrections done or corrective surgery done to this region in the neck. More often than not, it has been the lumbar spine. Those are the most common areas. The space between the L4, L5, and the L5, S1 are the most common discs that I see that have either had surgery performed, they've had a discectomy, that is a removal of the disc because it degenerated to such a degree and it was sequestered, which basically meant the fluid was coming out. In situations like that, it is surgery, it's corrective surgery that typically needs to be done. Now, when it comes to a herniation, there are kind of four items or four types, if you will, of herniation. Two fall under the category of it being contained, and I'll explain that in a moment, and two fall under the category of being not contained. So the first two, what I mean by being contained, it means that what's called the annulus, the actual disc itself has this ring or sequence of structure around it that the fluid's contained within. It's almost like building a sandbag or a sandbank with sand and then containing water in it. So for as long as that sand is raised up enough, that fluid, that water will stay within it. As soon as you knock down a part of that sand and the fluid has the chance to leak out, it will. And that's what can happen with the disc if we're not cautious and careful and take care of our spine, is it can degenerate to such a degree that that fluid within the disc can sequester out, actually leak out. Now, when it leaks out, that's when it really starts to create some major symptoms, shooting pain down the leg, numbness and tingling, motor detriment too in terms of how you're walking and moving. And it's just really, really ruddy, painful. And so that's usually where surgery is going to be indicated. But very often we can catch it before it even gets anywhere near that. We've got to pay attention and listen to our bodies. Remember, I speak a lot about this. We've got to listen to our bodies. So the first two fall under the category of being contained. One is a bulge and one is a protrusion. Essentially, they fall under the same umbrella of them having the annulus, the space around the actual fluid that's containing it, that's deteriorating. Now, if it deteriorates more, it actually forces that fluid to push out and bulge, right? To bulge out into the space where now you've got nerve tissue, which is then you start to get symptoms traveling down into your leg, and it's all sorts of pain. And then the next two fall under the category of being non-contained. One is an extrusion, and the other one is a sequestered or free fragment. Basically, it means that the fluid is not now being housed or contained in that space. It's actually starting to seep out or fully leak out. So that's kind of the two last categories. But nonetheless, what we're trying to do here in educating you is have you understand if you have low back pain that could be coming from a disc pathology, is have that further evaluated. Now, in my blog that I'm sharing the link below in the description, just click on it, sends you to my website, which has this particular blog focused on this. I teach you what is called a slump test. This is one of the foundational tests that I use in my clinic to help identify if this is coming something from a disc or if it's more originating from a muscular issue. And it works very well. Now, truthfully, to go next level, and you want to be very particular about identifying if there's an actual disc pathology going on, then I would highly recommend to get an MRI. Now, for that, you would obviously need to go see a physician, and they'll do a sequence of tests, one of which will more likely be this slump test that I'm talking about. But very often, to understand if you have a disc pathology going on, you'll have shooting pains down your leg. If you bear down for a bowel movement, cough, sneeze, you may get some sharp pain happening. You may also be getting motor performance issues, how you walk, how you stride, and shooting pain as you're doing that. These can be symptoms that it can be, but it's not strict. It's not strict that just because you have those symptoms, it is definitely a herniated disc. This is why it's got to be explored beyond just this basic idea of understanding the general symptoms, because some of those symptoms I've just described can arise purely from the sciatic nerve being trapped by the piriformis muscle, or highly contracted erector muscles that are compressing on the nerve tissue. And so as a result, we can have very similar symptoms to a disc herniation, but it's actually coming from a very severe muscle spasm, muscle contraction, or hypertonicity of those muscles in and around the hip. So we've got to learn to delineate between the two. And this is where bringing in a skilled therapist, somebody who knows how to help assess this for you, start to treat the tissues, see what results you're getting, listening to your body. But the bottom line, whether it's a muscular origin or a herniation disc or a herniated disc, without being held hostage, remember, we don't want you to be plugged down by that much pain. That's the whole goal of me educating you on these ideas, is follow my video that I put in the description again below. This video is teaching you what is known as the Mckenzie Push-Up. Anybody who knows anything about herniated discs should be teaching you about what is known as the Mckenzie Push-Up. Now, qualify this again. I always say this with any of my exercises I'm recommended, is do have a physician supporting you, or a physical therapist, massage therapist, chiropractor, whoever is part of your health team, to help you understand if this exercise is going to be best for you. But one particular patient who this would not be great for is somebody who's got a pre-existing condition such as spondylolisthesis, which is basically a shifting, a gliding forward of the lumbar vertebrae. Usually 2 or 3 of those vertebrae are actually into more extension and sliding forward off their axis, which then if you get into a Mckenzie push-up, as I described in my video, you may find your symptoms are being exacerbated. So guess what? You listen to your body once again. If you're doing this exercise and you find that it's making it worse, stop it. Modify or go see a therapist and have somebody guide you a little bit more. And maybe also how you're doing the exercise. You might be just pushing too much. You might not be getting the right position. So follow my guidelines in the video. But if you feel like you need further assistance, then definitely go see a skilled therapist who's in your area, who can navigate this a little bit more with you and even give you more instruction on what I'm sharing in my video this week. But generally speaking, this is a very therapeutic exercise, because think about how much time you spend in a seated, flexed, rounded forward posture. It's a lot of the time. And even if you're like me working as a massage therapist, I'm bent forward, I'm over a table, I'm leveraging forward. So I have to take care of my body just as much as anybody who's sat for most of the day, because we're all accumulating this compression in the lumbar spine. That's the lower part of the back. And we need to raise, we need to lift, we need to decompress that area. And one way to do that is using the Mckenzie Push-Up. So if we decompress that area, now the discs have more breathability, let's call it, and they allow the centering. That's the whole goal with this, is they allow the centering, repositioning of the fluid within the disc space. And so the way I describe it to my patients, this is almost like having a level, that you have that bubble in the level and you put it on a surface, and if it's not level, the bubble goes one way or the other. It's the same with each of the discs in your spine, that if the bubble is not centered, the fluid is not centered within that spinal space or spinal disc space, then you start to get this wear and tear on those elements that are surrounding the fluid, and it wears and tears more on one side than the other. And as a result, it can create erosion, which can lead to then the more complicated, if you will, disc pathologies. So the bottom line, whether you've got symptoms or not, this is a very therapeutic exercise to keep your spine healthy, keep your lower back healthy, decompresses the back, takes the pressure off, also gives you some time away from being in that seated or flexed posture as well. So thank you. I hope you found that a benefit. I want to hear from you. Give me some feedback in the description below, or if you're listening to me on a podcast, do that through the podcast provider that you're listening in on. And thank you very much for your time. Make sure you go get my free book whilst it's still available for free. You just go to jasonbarlowrmt.com, leave me your email. I'll fire off you an email. And remember, your muscle health is my #1 priority. That's why I'm here doing this for you. So any feedback, any comments helps me to help you even more. So thank you and have a great day.